Good evening, everyone. A warm welcome to this neurotherapy session coming from Joshi's Kerala group. And we all know that how dedicated and punctual and passionate our Acharyaji Ramachandran sir is in teaching all these free sessions for you. The two valuable sessions which are mostly taught in the paid classes or higher classes. But sir has taken time for you. And so please, I request all of you to please share this link with all your family and friends so that they also can join because this is not other therapies. Neurotherapy is something where you have to watch, where you have to do the treatments properly, and you have to find out the exact place, which is not easy otherwise to, just watch videos and go through and like that. You have to always be in the live sessions for neurotherapy. Then only you can watch, because when we watch, what happens is we remember, and when we try to do it on us, we remember how to do it exactly, where to do it, where to place our hands. All these are very important for treatments. When we miss these hand movements, hand placements, or how to do it, the count, the timing, everything is important. So I request all of you to please stay in the session from starting to ending. Keep your notebooks, pens, and your minds ready for this session. Invite your family and friends so that, see, one more problem is in neurotherapy, unless others understand, they won't be ready for this treatment also. So you just make your family or friends sit with you, let them watch, let them understand, so that you, when you do on them, they know you where you saw and how you saw it from a professional and how you are treating, right? So this will be helpful for your family to understand how they are performing, and they will correct you also when you are doing some mistake. So this is very important when you are with your family, friends. Just share this video, watch together, learn to understand. And just like earlier, we used to say combined studies. So this will be a combined study for all of you when you sit together and watch with family, because these treatments are very, very, wonderful, precious, and getting it from the international neurotherapist for all of you is really a gem. So please don't miss these gem of sessions. And I request everyone to you, please join on time, because many of you join late and again keep asking why the session, I missed this session, I joined late, I am back from somewhere. Please don't do that. This session is particularly provided, even the trainer is coming on time. When the trainer is coming on time, the trainer is dedicating time for you, why can't you dedicate, right? So please dedicate this precious time, and the only gratitude you can give is accumulating this particular time and learning for better. So neurotherapy is something which can deal other issues also in your body. Just like, it might be treating your other health issues like gas, acidity, bloating, or some other small to big, side effects which might be affecting your body due to the medications you take, because of the lifestyle problems you have, because of the food you intake on wrong times. So much of information you get from these classes. So much of, corrections are made in these classes. So please, I request once again not to miss these valuable sessions. And please join on time. Keep your books, pens. If you are not ready with your books and pens, you just run back. Run back, get your pens and books, and put your minds here so that you can clearly understand what is happening in the session. Because sometimes I too understand when pan 6, liver 1, MO1, all these are said, you might not understand what it is. But that is explained in the later part of the session through treatments. So you have to make notes And you all the things, videos, recordings, and the treatment procedure, if you don't understand, is always provided by our Ramachandran sir in the group. So you can, unless you critically sit down and religiously listen to these sessions, you can't understand anything. And especially when you're joining new, it is very important for you to listen carefully. So I just want your minds here. And without further waiting much time or wasting much time, let me welcome with your warm hearts. I'm sending this warm welcome to Ramachandran sir today. Good evening, sir. A warm welcome to you. Please take our gratitude for this session from Joshi's Kerala Group. And thank you so much for dedicating your time, patience, love, and passion of teaching for us. Thank you so much, sir. Please take over the session. Good evening, sir.
At the outset, of course, I would like to thank Joshi's Kerala Group, Joshi sir and Anusha madam, for hosting such a wonderful platform. And now here you can see on the screen the founder, pioneer of this wonderful medicineless therapy called Lajpat Rai Mehra's Neurotherapy. So our salutations. He is really the man of the millennium. He is the epitome of Dhanvantri. We all see him as an epitome of Dhanvantri, the god of health. And he is the pioneer founder of neurotherapy, most revered Guruji, Dr. Lajpat Rai Mehraji. Okay, so we normally welcome him in our classes with the following slogan: Yug Purush, Dhanvantri Swarup, Neurotherapy Ke Janak, Param Pujya Guruji, Dr. Lajpat Rai Mehraji ki Jai. This is how we pay our obeisance to him. So with that, we have started. And as you have seen, this class of mine is both theory and practice. And the theory also I explain why a particular treatment is being given, what are its uses, etc. And of course, I have shown the practicals. Still, for people who have joined new, you will have a very short recap of what I taught last week. So that, and for the old comers, people who are already attending, for them it will be a revision. So it will be a wonderful thing. So without any delay, let us go ahead. So in our previous class, we have seen that according to LMNT stands for Lajpat Rai Mehra's Neurotherapy. So according to that, stones, why are they formed? Number one, kidneys are not getting proper blood and nerve supply. Number two, digestive toxins are accumulating. Why they are accumulating? Because of improper liver functioning. That is, liver is not getting proper stimulation. And then as a result, bile flow is not happening properly. Then there is a hormonal miscommunication in some people, because the medulla, that is the key of the whole process, from the communication from the brain is through the medullary center. And then there we have a pituitary gland which works under the hypothalamus. The hypothalamus passes the order that's called releasing hormone. Then the pituitary gland takes it up, and then it processes further stimulating hormones. So that whole, these things, the miscommunication also leads to formation of stones or any other problem in the body. Then the fourth one is dehydration at the cellular level. Even though the person says he is drinking a lot of water, he is still not able to process that water. And so there is dehydration within the cells. So what are the steps? We have already seen one step last week. I have shown you exhaustively how the treatment is to be given. So today I will just be touching that, because you must remember this 2 pan into 6. I am sharing the PDF, the PPT for you, because I want you to see and also remember these code names. Just as you are having so many code names for acupressure and acupuncture, like that, these code names for people who want to learn neurotherapy and who want to progress in neurotherapy, treating themselves or treating others, for them these code names are a must. It is like ABC of any of the language. You cannot say I don't wish to know ABCD. What is this? This some strange characters, and still I want to write a letter. Not possible. No. So like that. So these, whenever I use these words, I want you to all pay attention. You have seen last week what was 2 pan into 6, and I told you that 2 pan into 6 works in different ways, in different parts of the body, the problems. But here we are using it for improving the blood flow to the kidneys, and primarily we are using 2 pan to break or to make smaller size the stones which are bigger in size. So the 2 pan is useful for kidney stones as well as for so many other problems. Then P heparin 6 ADR, we are increasing it to using it to increase the circulation. And then the most important formula, that is the kidney clearance formula, and that has got 3 liver 0, 3 mucus 0, 4 chest only, and 10 round arrow. So this is a code name. You can at least remember the word kidney clearance formula. Then I have already shown you how it is to be given. Then in the last class, I also showed you that if somebody has pain in the flanks due to kidney stone, then we have to give the treatment called 3 liver 0, 3 mucus 0, 8 thymus chest till the pain subsides. That is important. Repeat it till the pain subsides. So what are the purpose? Now a small amount of revision of theory. That was the practical which I have shown already towards the end of this thing last week's classes. So now what are this? These 3 together, they work together. These 3 treatments work together. So they are direct stimulations of the kidneys. First of all, it does deep circulation and detox improvement. Then enhances filtration at the kidneys. And most importantly, it enhances nephron filtration efficiency, which is what we want. And how does it do that? By improving the blood supply to the kidneys. And then by doing all this, it supports urine formation and excretion, relieves local congestion, swelling, or inflammation. And then we have a hormone called aldosterone, which is responsible for salt water balance. So this treatment balances aldosterone and thereby indirectly improves hydration at a tissue level. I told you that dehydration is a very big problem. People say they are drinking a lot of water, but still they are having problem. So in that case, this is very useful. Then by all this, by my formulas, it reduces systemic inflammation that can worsen hypertension. Thus, it supports blood pressure and energy metabolism. And how are these treatments really relevant to kidney stone patients? As I said, it improves kidney function because it helps in dissolving and clearing small stones, flush out inflammatory debris and uric acid crystals. How does this form? Excess sodium promotes calcium stone formation. So all that is cleared by our treatments. Then we need peristalsis in the renal pelvis. Peristalsis is the wave which moves things from one end to the other. And we need this wave in the kidneys. We need it to throw the urine properly outside rather than getting stagnated within the kidney. So that is where the peristalsis it is. Thus, it is aiding in natural stone movement. Then it supports electrolyte balance, which is important in calcium, uric acid, or oxalate management. Then it lowers local inflammation. The 6-ADR, we have got a formula called 6-ADR that lowers. See, you can see here this formula called 6-ADR. So this lowers local inflammation, especially when there is a back pain or hematuria, blood in urine. And finally, it aids in reduction of oxalate overload by improving fat metabolism. And now you also have another treatment which is going to improve the liver and gut health and thus influence uric acid and oxalate metabolism, which is the key in stone formation. So this was a little bit of theory. Since this is a class devoted to practicals, So you may be thinking, what are the other problems, other symptoms where our neurotherapy treatments can help? So here, since it's devoted to practical, so I will be showing a lot of practicals also. So I suggest that those who are having issues related to kidney stones, please do all these treatments with me. And as I said in the last week's class, the beauty is that neurotherapy, unlike medicine, can be done by people who do not have any problem also. In medicine, you have to take a medicine only when you have a particular health issue. But here, suppose you don't have a health issue and you still want to keep yourself fit, then also these formulas can be used. And wherever a particular formula cannot be used, I will be mentioning, I will give the warning. Okay, so we'll see that also. So now here is a list of different symptoms associated with kidney stones. This includes both common and lesser known symptoms, which are especially relevant in the Indian context. So the most important, simplest, this thing for a problem for people with kidney stones is flank or side pain. And it is so sharp, it is intense, radiating to the groin. Then you have painful urination. Always it shows up as burning sensation during menstruation. And the real problem is it will burn so much that you feel very uncomfortable. You feel uncomfortable if you don't pass the urine, you feel uncomfortable during passing urine also. That burning sensation lingers. That's all due to kidney stones. Then blood in urine. This is due to urethral trauma from the stone. We have the ureters. They are the ones which are bringing the urine from the kidneys to the bladder. They are called ureters. They are two pipes. So they can get injured. Trauma means injured due to a stone. Then that will cause blood in urine. Okay, then frequent urination. I will be covering this a little bit. The treatments just now, I'll be covering. Some of them are already common. We'll be covering it. So if anybody of you is having any of these problems, please pay attention. I am going to show you the exact treatment which is needed for these cases, the symptoms. Okay. So now we have frequent urination. This is a very common problem, and that is due to irritation of the bladder or lower ureter. Then nausea and vomiting is also a very common problem, and this is due to pain or nerve irritation. Then very important, the symptom of kidney stone is fevers and chills. That is due to the stone and because the infection is serious. And cloudy or smelly urine is due to infection or pus. And dribbling, low output is due to partial or full urinary blockage. Then pain in the genital area is due to referred pain from lower ureter. And restlessness during attack is because of classical feature of renal colic. And swelling in chronic cases suggests kidney function compromise. That means kidneys are not functioning properly. Then you will have swelling, especially in the feet, etc. Then this, in certain temperatures, it worsens in dehydration when you don't drink proper water. Why? Because the stones move. Whenever there is low hydration, you are not drinking proper water, then stones cannot move properly, and so the pains worsen. But yet, the last but not the least is called no symptom, silent stone. This is detected during imaging. So for each one of this, what should we do? So let us study each one of them and the individual remedies. The most common, severe flank or side pain. How does it manifest itself? Sudden, sharp pain on one side of the lower back or side between the ribs and the hip. Very sharp shooting pain. Okay. Then this often radiates towards the lower abdomen or groin. This pain may come in waves and vary in intensity. This is the most classic and common symptom. And for this, I have already shown you this remedy, 3 liver 0, 3 mucus 0, and last class we ended with 8 thymus chest. So this is the classic remedy for stones and for this pain. Now here the warning is that in case you are a diabetic, in some diabetics, in some, not all, in some diabetics, this may increase the blood sugar level, but it does not matter because those diabetics who are already knowing they are having sugar, the problem, diabetes is there, then they would be taking proper medicines. So on the particular day when we are giving this treatment, what we tell them is, you please take your medicines correctly, please take your treatments also correctly. And so in case there is a slight increase in blood sugar, don't worry. The moment the pain goes away, then we will reduce this load. So this is 3 liver 0, 3 mucus 0, 8 thymus chest. In that case, we will give 3 liver 0, 3 mucus 0, 8 chest only, 20 round arrow. That entire treatment has been shown last week. Okay, then you come to the second symptom, burning or painful urination. This is called dysuria. Burning or painful urination, dysuria. Okay, what is this? This is a sharp burning sensation while urinating. You feel as if a red hot needle is passing through your through your organ. Like that you will feel sharp burning sensation. When that comes, that is common when the stone is either inside the bladder or near the bladder or ureter. Because ureter is the pipe, no? So you have two ureters. So anywhere over there, if the stone is there, that means the stone has come out of the kidney, which is higher up, and it has come down into the bladder. In that case, you will have this type of a painful urination. And what is the remedy? Though, of course, we have all the other formulas we have told you are already, they have to be given. The remedy is tender coconut water. In this connection, I will like to just pay attention to a particular fact. Maybe you may not have realized that coconut water has the ability to dissolve stone, real stone. You might have seen in certain temples, there is a stone on which the coconut is broken. You may not have noticed. I have seen it in 2-3 occasions. That stone is many of the time it is just becoming whole is there. The hole is not because of breakage, because you break on the edge. The hole is because the stone is being corroded in a way by the coconut water. So I am not saying anything derogatory. I mean to say kidney stone is also a stone. When a stone a rock can be corroded by coconut water, see how easily it is for the kidney stone to just get dissipated. That is why tender coconut water is very good, especially when you take it along with neurotherapy treatment. Okay. Then you have blood in urine. This is called hematuria. This is, of course, not a very common thing. Not everybody has blood in urine, but the urine may appear pink, red, or brown depending on the amount of blood which is coming out. And this may be visible or microscopic. Either it may be visible or it may come out only in lab test. Lab test, they may say blood in urine, whereas you are not able to see the color, perhaps. So this bleeding, why does it occur? It is due to stone scraping the urinary tract lining. And for this, we have a treatment, wonderful treatment. This is called 1 gall, 4 liver, 8 thymus chest. Now, though these points are already known to you, perhaps, but still, I will just show you how this treatment, very simple treatment, and this treatment is useful in removing many pains due to injuries, etc. 1 gall, 4 liver, 8 thymus chest. This is the simplest treatment for removing pains due to injuries. And since there is blood in urine, that means there is an injury to the urinary tract, somewhere over there, lining. So this is very good. So now we will see this treatment. As I told you, I will be giving exhaustive practicals, I said. So this treatment is very useful for all pains due to related to stones or otherwise also. Okay. And only this thing caution is because it contains thymus chest. People with autoimmune disorders should be careful. I don't say it is always bad. Sometimes it brings very good results. They should be careful. If they are having autoimmune disorder, they will do best not to give this 8 thymus chest. Instead, they will give chest only round arrow, which I have shown last week. Okay. So other people can do this, whether they have a problem or not. This will help them in overall, improving the body function, because gall and liver are always sluggish in most people. Okay, so this can help them. So now let us see. I'll be stopping the share and then I'll start the other. Now we have to stop this video. I've got another. Okay, now okay. Yeah. Are you all able to see me clearly, Anusha madam? Now I've shifted my other camera. Or anybody else can answer. Are you able to see me clearly? I can't hear you. Anusha madam? Oh, you can't see me. So you can hear me, but you cannot see me clearly. Okay, thank you, Mr. Fido. Okay, now what do you do? Hello. Okay, I got it. Okay, fine. Yeah, thank you. Yes.
Any problem, sir?
Yeah, I wanted to know, I was asking whether you are able to see me. Now I changed the spotlight. Somebody, Sonali ji asked me to change the spotlight. So now I think it's okay. Can you see me clearly?
No, the spotlight is some different, no? One second.
No, I have changed the spotlight just now.
But where are you? Your video is on, not on, no?
Yeah, it is on. No, I have changed my my video camera because I have taken a different camera.
Yeah, now you are visible.
Okay, acha, you have to change the spotlight, is it? I cannot do it. Okay.
You can do it, but whichever video is open, like in your phone, if it is open, you have to open that particular spotlight.
Yeah, no, I did that. Somehow it did not work. Okay, no problem. Okay, fine. Thank you, Sonali ji. Thanks a lot. Okay. Fine. Now it's okay, na? Fine. Okay. So now 1 gall, 4 liver, 8 thymus chest. Gall is on the left thigh. This is my left thigh. So gall is on the left thigh. Liver also over here. And thymus chest is over here. Okay, I'll show you. So 1 gall, 4 liver, 8 thymus chest. So what we do, we are pressing with the flesh of the palm. I'm pulling this side. So I pull inwards like this. I pull inwards 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Second location 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Third location 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. So between this is the kneecap, just before the kneecap to groin, I have covered it in three locations. Some people may require 4 locations. Okay, whatever. So you cover this entire width. So this was one gall. Then liver, 4 liver we said. So okay, first liver over here. As I always remind you, please, this bone should press down. That means I have to press here and simultaneously press here. So that's how I am doing. So let us see. Pull again, pull inwards. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Then second location, middle of the thigh. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Third location, sorry, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. So this was 1, 2, 3, and fourth in the middle. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. So this was one gall, 4 liver. Okay. Now thymus chest. So thymus chest is very simple. I just give from here slightly 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then my left side, I move my hand like this. 1, 2, 3, 5, 6, 7, 8, 9, 10, 11, 12. Then armpit, I have to give a little bit force. 1, 2, 3, 4, 5, 6, 7, 8. So 12, 12, and 8. Then here, this side, always, whenever we are moving, hand should be at shoulder level. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then here 1, 2, 3, 5, 6, 7, 8, 9, 10, 11, 12. Then 1, 2, 3, 4, 5, 6, 7, 8. Now this is a very simple treatment. If you necessary, it can be repeated every 15 minutes or every 20 minutes till the pain is stopped. So pain stoppage is the key. Okay. So with that you can understand. One gall is from here to here. 4 liver, I have shown you 1, 2, 3, 4 in the middle. Then thymus chest 12, 12, 12. I mean 12, 12, 8 and 12, 12, 8. That's all. So this can be repeated. Okay. So now we go back to the main. And this was for blood in urea, blood in urine. Okay. Now we'll come again to. Okay. So now, then here you have a frequent urge to urinate. This is also a very common problem. The frequent urge to urinate. And for this, we require, see why that frequent urge to urinate is there, because the stone is there, it is in the lower ureter or in the bladder. So whenever there is a stone or blockage, it won't give you a lot of opening, it won't provide. So what happens? A little bit with the pressure, a little bit urine will come out, and then later on it cannot come out. Like that it goes on. So it comes out in bits and starts. So whenever that happens, what you will do, you will have to give the treatment. First, you have to make the stone smaller. And for that, the classic treatment is 2 pan into 6. So 2 pan into 6 you have to do. Then you have got 8 pan, 6 WD, 8 thymus chest. So these two I will show. But in the meanwhile, we will go to nausea and vomiting, because that remedy is already known to you right now. 1 gall, 4 liver, 8 thymus chest. We did it just now. So this nausea and vomiting is due to shared nerve pathways between the kidneys and the digestive tract. Now, kidneys and digestive tract, they have shared nerves. Certain nerves are common. So, because of that, they, whenever there is a pain in the kidney, it will not permit you to eat. Nausea is, it just says, do not bring any food. I am already having some problem. So let me set it right. So it does not allow you to eat. And that is why you are having that. And this is nothing but the body's reaction to pain or urinary obstruction. So body's reaction to pain or urinary obstruction, that is, remedy is 1 gall, 4 liver, 8 thymus chest, which we did just now, along with all its, I mean, who should do, who should not do, everything same. Okay. So now we will come to this point: 2 pan into 6, 8 pan, 6 WD, 8 thymus chest. Now we'll do that treatment. Let us see. Okay. Okay, now, so you can see me very clearly again. 2 pan into 6. Now pan is given over here. Pan is given over here. And I normally give pan like this, like this. Okay. So we have to press our hands and we have to lean a little bit. We have to lean forward and also bring our hands inside like this. Okay. So 2 pan means same location. I will give 6-second pressure twice. And then I will wait for 1 minute. Then again do the same thing. Like that we'll do it completely. All of you can do with me. Where for waiting period, I do alternative nostril breathing. So you can all do with me. Okay. So 2 pan into 6. Okay. Now you might have seen, those of you who are new, you will know it is new. Okay, because you have not seen it earlier. But those of you who are old, for you also you can do this. 2 pan into 6. Don't worry, anybody can do it, and everybody will get benefited. That is why I am telling you to do it. Okay. So now let us start. Okay. Fine. Now, what I have to do, I have to first press my hand down and then I will bring it inwards like this, like that I will do. Okay. So I press down, bring inwards, lean forward, 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Now lift and again keep in the same location. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. This is 2 pan once into 1. Okay, we have to do another 5 more times. So the next one I will count 2, 1, then 3, 1, 4, 1, like that. Then you will know 6 times I count, then it's into 6 treatments is over. So now we'll do a little bit of alternative nostril breathing, Nadi Shodhi Pranayama. Okay, please inhale from the left, exhale from the right. Inhale from the right, exhale from the left. One more round, inhale from the left, exhale from the right. Inhale from the right, exhale from the left. Okay, so now we are ready for the second round of 2 pan. Again, same location, 2 pan, press inwards or lean forward, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Lift and again repeat 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. So this was 2 pan into 2. Okay, now again Nadi Shuddhi Pranayama. Inhale from the left, exhale right, inhale right, exhale left, Inhale left. Exhale right. Inhale right. Exhale left. Now we are ready for the third round. Third round of 2-pan. 3-1, 3-2, 3-3, 3-4, 3-5, 3-6, 3-1, 3-2, 3-3, 3-4, 3-5, 3-6. Okay. Then again, Nadi Shuddhi Pranayama. Inhale right now. Exhale left. Always we start from the left and end in the left again. Then inhale left. Exhale right. Inhale right. Exhale left. So now for the fourth round, so again press inwards, lean forward, 4-1, 4-2, 4-3, 4-4, 4-5, 4-6, lift and again repeat, 4-1, 4-2, 4-3, 4-4, 4-5, 4-6. Again start inhalation from left. Right, exhale right. Inhale right. Exhale left. Inhale left. Exhale right. Inhale right. Exhale left. Now for the fifth round of 2-pan, again same location, 5-1, 5-2, 5-3, 5-4, 5-5, 5-6. Repeat, 5-1, 5-2, 5-3, 5-4, 5-5, 5-6. Again inhale from the left. Exhale right. Inhale right. Exhale left. Inhale left. Exhale right. Inhale right. Exhale left. Last round, 6-1, 6-2, 6-3, 6-4, 6-5, 6-6. Lift. 6-1, 6-2, 6-3, 6-4, 6-5, 6-6. So this entire thing was 2 pan into 6 treatments. This breaks up the stone. It breaks up unwanted clots in the body. It breaks up small lipomas, blockages, etc. So many advantages it has got. And unbelievably, it's a very short 6-minute practice. And with that also a lot of gap in between. Only thing is, preferably, you should give about a minute gap in between each of the 2 pans. Okay. So 2 pan into 6. And now we wait for a minute or so, 1 minute or 2 minutes. Then we come to another treatment. That is a treatment especially meant for relieving lower abdomen pain. And as I told you, this is now this frequent urge to urinate that is often associated when the stone has come down into the bladder or in the lower ureter. That is why the frequent urge to urinate comes. So then first you have opened the pathway by 2 pan into 6. We have opened the pathway. Then we have to give another treatment. So in that, what we will do, 8 pan, 6 WD, 8 thymus chest. Now this WD is something which is not so easy, I agree, for doing ourselves, but still whatever we do, you understand the principle. Later on, those who are having active stones, you can get it done by your relatives, whoever is there in the house. But right now I will show you where and how it is to be given. I will show you the sequence. Then you can practice it with your relatives. Okay, you can tell the relatives to do the same way. So pan is given over here, which you have seen. WD is given over here when you are lying down on the bed. WD is given in both hands like this. First location here, second location middle, third location here. Similarly here, first location, second location, third location, and hands are like this. Okay. So whoever who has stones, what you do, you lie on the bed and ask your relative to press first location in both places, 6 seconds. I will show you anyway. And then of course thymus chest is the same, common. Okay. So with this, you find wonderful results in many places in the body, many parts, especially any pain related to even uterus, etc. Uterine pain also will go by this treatment. That is why I am saying everybody will get benefited. If you have any prostate gland problem, it will get benefited. If you have urinary bladder problem, it will get benefited. And of course, uterine problems like that. So let us all start. Okay, very simple treatment, very effective treatment. 8 pan, 6 WD, 8 thymus chest. Okay, 8 pan, 6 WD, 8 thymus chest. So now 8 pan, same location. Okay, so what I will do again, same, I have to press like this, but now I will not stop after 2. I will go up to 8. 8 times I have to press in the same location, 6 seconds pressure for each time. So you can do it with me, then you will understand. You can see me and do it with me. Okay, so now let us start. Lean forward, pull inwards as usual, always. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Lift and again press 2, 1, same location, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Same location, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Fourth time, 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Fifth round, 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. Round 6, 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Seventh round, 7, 1, 7, 2, 3, 7, 4, 7, 5, 7, 6. Then 8th round, 8, 1, 8, 2, 8, 3, 8, 4, 8, 5, 8, 6. This was 8 pan. Now 6 WD. How do you do? With both hands, I will clasp like this and like this. So I am clasping. Okay. and I'm applying, see, I'm applying pressure approximately in the middle location. Okay, in the middle location, approximately over here, I am applying pressure. One location here, two location here, third location here. Similarly here, 1, 2, 3. So when you do it one full round from here to here, that is called 1 WD. Like that, we will have to do 6 rounds. That means 18 locations. Okay, but you can do it. And later on, once I give you the practice, you can get it done by your relative. Okay, so let us start. So like this, 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Come to the middle location, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Come near the wrist, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Second, this was first round. Second round, 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. So we'll count 2. Second round, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. List 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Third round, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Middle place, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. And wrist, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Fourth round, 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Middle location, 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. And 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Fifth round, 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. Middle place, 5, 1, 5, 2, 5, 4, 5, 5, 6. End 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. Last round, 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Middle location, 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. End 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Then slightly you may have pain because you have done it yourself. Just shake your hand. Okay. So this was 8 pan 6 WD. Now 8 timers chest. Very simple. 12, 12, 12, 8, 12, 12, 8. Like that. Repeat once more. Okay. So 12, 12, 8. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12. Then 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12. Then here armpit 1, 2, 3, 4, 5, 6, 7, 8. This side, center 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12. Then here 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12. Then here 1, 2, 3, 4, 5, 6, 7, 8. So this was 4. Now one more round like that. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12. Here 1, 2, 4, 5, 6, 7, 8, 10, 11, 12. 1, 2, 3, 4, 5, 6, 7, 8. And this side 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12. Then 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12. And 2, 3, 4, 5, 6, 7, 8. Okay, no problem. No problem. Okay, so this is very simple. 8 pan, 6 WD, 8 timers chest. Wonderful treatment for those who are having frequent urge to urinate. Now, you have always seen that I always try to give alternative techniques for people who are able or unable to do certain points. So now I have shown you one way of doing this WD. Another way is that for people who are having a different type of flexibility. So where you have to do, so you have to apply pressure here, isn't it? Now, how else can you apply pressure over here? A very simple technique is just to keep you lie down flat on the bed. You lie down flat on the bed and then just keep your body, your bum actually, you keep it over this. So I will hold both my hands like that, and then I can keep my position such that different places get pressure in different times. I can do that also. I do not know how many people may be able to do it or not, but I will show you the method. For people who find difficult, see, there may be somebody who are having too much arm pain, you cannot lift the shoulder. Maybe there, isn't it? So for them, another alternative method is that these are all things which I don't, which we, except our senior therapists, we don't teach all these things, because this sometimes it makes people feel funny. What is this man is teaching something? But I want results, and I want people to understand that I am committed to giving you the best solution. And that is why I teach all these things. Of course, those who have benefited, they have benefited a lot. There is no doubt about it. So how do you do that? So very simple. This is for only 6WD. I'm showing you one round, just like that. You can do later. If you want, you can do it this way, or you can ask somebody to press you, no problem. But I'll give you the alternative. No, this is just like last time I showed you that over here we can do something for the spine. Over here, this was an alternative. This is based on Sujok or whatever. Okay, so like that. This is of course based on my own personal observation and inference. So how do we do? So all that you have to do is just keep your hand like this. Keep both hands like that, and then see, now I am lying. Now I am lying straight. I'm lying straight. So now when I am doing like this, when I am lifting my leg forward, the knees are closer to my stomach, then I can see I am getting pressure near the elbow. So I stay here for 6 seconds. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Then slowly I bring my leg down. I can even rest it over here. So this I am seeing it is affecting the middle elbow. I mean middle arm. So 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Then what I do, I stretch my leg completely. So this is giving me nice pressure near my wrist. So 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. So very simple technique. So this is also a method by which you can do WD. Depends on how you are flexible or how you are open, and depends upon your, whether you have a friend to help you or you don't have a friend. If you don't have a friend, then this is very good, isn't it? Or you can do like this. If you are flexible, you can even do this way. Okay. So whatever way you do, you can do it. This is a wonderful treatment for all problems related to below the abdomen. That is why I'm telling again and again, it can help prostate gland problems, it can help uterus problems, and of course, it can help stone problems. So now after that, we again come back to a little bit more. Another, this thing we have already seen, nausea and vomiting. I told you 1 gall, 4 liver, 8 thymus chest. Now we have got, suppose, now let us share this. Okay, now we have got almost 83 people or 82 people. Very good, wonderful. All of you are joined. Just give me a minute. I just drink some water. Okay. So now we have got this fever and chills if infection is present. Now in neurotherapy, we have seen that chronic infection leads to inflammation. That means it started as an infection, and whenever there is infection, we give thymus chest. Then when it proceeds to inflammation, then you will not require thymus chest at that time. you will require a different treatment. Okay, so suppose somebody says, I have fever and chills. That is when infection is present, it happens. So it suggests infection of the urinary tract or kidneys. Okay, this is called pyelonephritis. Whenever you come across the word which contains itis. Okay, here you see here itis. So then itis means inflammation. So inflammation, we treat it with 6-ADR, which I have shown earlier. Okay, so now here what we will do, fever in stone patients. Patient says he has a stone and they say you have a fever also. Then for them, we will first give 30 medulla. I'll show you 30 medulla. Very simple it is to show. Okay, 30 medulla. Then along with that, we will go to 1 point liver into 6 treatments. Now you should understand that neurotherapy, certain treatments have to be done continuously. Certain treatments have to be broken now and then, given gap and all that. So this first we will give 30 medulla, then wait for 1 minute, then we will give 1 point liver as I will show you, and there I will have to wait for 1 minute. I have to do it 6 rounds. Okay, so that is how it will be. Fine. So now we will go to 30 medulla. Again, I'll stop share. So medullas are given. We start with the left side, left ear, then go to the right ear, right side. Okay, where it is given, those of you who have been with me, you know. See over here. Okay, I am going to start from here. This is just, this is a skull, just behind the ear. Behind the ear, this is the end of the skull. This is coming from here like this. Okay, now here, I start from here and I have to go vertically down up to the shoulder blade, shoulder bone, collar bone, let us say. Okay, so I will be using 1 finger like this and 1 finger like this. I'll be using 2 fingers. Here it is very difficult to do with 1 finger at a time because you have to count up to 60. You may make mistakes. So it's better 1, 1, 2, 2, 3, 3, like that we'll go. I'll do it slowly. Later, as you develop expertise, you will do it faster. Okay, so very simple. Now let us see. Okay, let's start. All of you can do with me. This is very good for lowering BP also. People who are having high BP will benefit by it. And it will also help to a certain extent for diabetic people also. So you'll all get benefited. And especially people who are having fever with stone, they will get very good benefit. So what are the things? Okay, so now we start. I keep 1 finger like this, then later on my 2nd finger will come down. So you watch carefully and do with me. 1, 1, 2, 2, 3, 3, 4, 5, 6, 7, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And at 30, I hold here for a few seconds. Just hold this. Okay, so this was 30 medulla on the left. Okay, then this is good for high BP, lowering systolic BP. Then we'll go to the right side. So again, same way. 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 21, 22, 23, 24, 26, 27, 28, 29, 30, and hold for a few seconds. So this was 30 medulla. This is, then wait for 1 minute. Again, as we will do, as usual, we'll do Nadi Shuddhi Pranayama, alternative nostril breathing. Inhale from the left, exhale from the right. Inhale from the right, exhale from the right. Inhale from the left, exhale from the right. Inhale from the right, exhale from the left. So this was 30 medulla we have finished. Now the next treatment is called 1-point liver into 6 treatment. So liver, you have already seen, liver is given on the left thigh and left arm. So I am giving first location here, second location here, third location here. Similarly here, first location, second location, third location. Okay. Okay. Yeah. If anybody cannot see me, please let me know. Okay. So now here we are just pulling inwards like this. So okay, thank you. Thank you. Okay. So now we are doing this from here. We are digging 1 1 2 2 3 3 4 4 5 5 6 6. This was first point of liver. Again, we have to wait for 1 minute. So I will just do small round of Nadi Shuddhi Pranayama. Then we'll go to second point. So immediately inhale left, then exhale right, inhale right, exhale left. So this is a short round. It is enough for liver because we have to go further. So this was 1-point liver in the first place. Now second location, first location was here, second location here, and here in the middle of the thigh. Again, we will pull inwards always. 2 1, 2 2, 2 3, 2 4, 2 5, 2 6. That's all. This was the second round of liver. Again, Nadi Shuddhi. Exhale right, inhale right, exhale left. So this was, we have done 2 rounds of liver. Now the third location here and here. So again, same way, 3 1, 3 2, 3 3, 3 4, 3 5, 3 6. That's all. So 3 rounds of liver are over. Again, we will be repeating the same thing. Okay, again, Nadi Shuddhi, inhale left, exhale right, inhale right, exhale left, now just word of caution or advice. See, some people may feel, why this waiting so much? We can do straight away 1 liver, 2 liver, 3 liver. Please do not do that. It has different this thing. It won't give the same result. When you give a treatment and you wait for that, it is like you are telling a servant. You have got a very faithful servant, and you are telling the servant, go and do this job. But you don't give him time to execute that job. You immediately give him another job. Then will either job be done properly? No, it won't be done properly. So similarly, when I am doing this liver, I am stimulating different portions of the liver, which is on the right side. Okay, this particular treatment will increase the circulation to different portions of the liver, and different portions of the liver do different jobs. You understand? So that's how it is. So that is why I say you have to wait for a few seconds. 1 minute. Okay, so that's all. So now we have done 3 rounds. Now let us go to the fourth round of liver. Okay, fourth round of liver. Now again, this is the first location. Same way, I am keeping pressure here, and with this I am pressing downwards here. So 4-1, 4-2, 4-3, 4-4, 4-5, 4-6. That's all. The treatment is very small, but it is very effective. Very effective. Okay, now again, now it should be small round. Inhale left. Exhale right. Inhale right. Exhale left. So now for the fifth round, that is the middle location here like this, middle location, and here also middle. Okay, so again I pull inwards, 5-1, 5-2, 5-3, 5-4, 5-5, 5-6. Again, Nadi Shuddhi, inhale left. Exhale right. Inhale right. Exhale right. Exhale left. So now we are ready for the last round of liver. Last round of liver is in the near the wrist and near the kneecap. So 6-1, 6-2, 6-3, 6-4, 6-5, 6-6. That's all. So this liver treatment is excellent. Excellent, I tell you. And especially very good for small children. For small children, rather than going immediately to antibiotics or this medicines, first you give this liver fever will reduce substantially within 2-3 hours. You will see the child is getting much better. Another thing is, when you give something like crocin or paracetamol or whatever, what happens? It does such a fast job that immediately the body will just chill down. It will become cold. It was, say, half an hour earlier, it was having high fever, and the body is burning with fever. And then immediately after that medicine, it starts chilling down. This is too much drastic, especially for small children. This is a very drastic way of, it is like, the car is going at 100 kilometers per hour, and suddenly I am applying a speed breaker, or I am applying the brake very fast. So what will happen to the car? You can understand. So similarly, it just spoils the system to a certain extent. That is why this is a very wonderful treatment. I have been recommending this treatment to many people, and then so many people have got results. We have got more than 5,000 neurotherapists working all around the country, and even in some places abroad. They are all getting wonderful results with this 1-point liver into 6 treatment. So you understand? So it's a very powerful treatment. So I want all of you to understand it and use it properly. Whenever I have time, I am writing in the group also. So many formulas. I am sending PDF. Why? Because I want people to get attracted to a very simple method. It's not that any other method is bad. Every method is good so long as it is not having active medicines. Okay, every method is good. But certain methods have been, we have got more than 8 to 10 lakhs of people who have got benefited by our simple treatments. So, and it has no side effects. So I am giving you something which is really good. So please try it out. Okay. As Anusha Madam has also been telling, you should try it out, all these things, then you will see the result. Okay. So now we came to fever and chills in the stone patients. Then you have got the treatment, this thing, a condition which is, many people find it, irritating, obnoxious, cloudy or foul smelling urine. See, cloudy urine, as you can see, when you can see the urine is not clear, then it is cloudy urine. Okay. Then foul smelling, you don't like it, even you yourself don't like it when you go to the bathroom, washroom. So that indicates, whenever there is foul smelling urine, it indicates the presence of pus. That is called pyuria. Okay. And presence of pus means infection. Okay. And so, and this can be done, you can see, find it in the lab test. So whenever you have a cloudy urine, please immediately go for lab test. I have got as a section later, which will come in some of the next classes, what are the diagnostic tests to be done for kidney stone patients, like that. I'll be covering it in great detail. So I wish all of you, now there are only about 80 people or so. I wish you please tell all your friends and relatives, anybody who is having any problem with kidney stone, etc., or anything to do with the kidney, please tell them to come and join this class. This is a free class after all. You're not having to pay anything. Whereas for operating the stone, at least 7,000 to 8,000, 10,000, or maybe more, you have to pay. Okay. So please tell them to join and then get benefited. Okay. Now, cloudy or foul smelling urine, it indicates infection or presence of pus. So it may occur alongside with burning urination. And the treatment remedy is very simple, which we have already shown you. 1 gall, 4 liver, 8 thymus chest. So this already, this problem is solved. And of course, along with that, you have to stay hydrated. You have to take coconut water is a must. Also consume coconut water. Okay. Then again, another treatment which you have already covered. See, that's why I said some treatments are so common. If you know the symptom, you can apply it on yourself and then you can get the result. So reduced urine output or dribbling. So this happens when either the stone causes partial obstruction or complete obstruction. So you may feel the urge to pass urine, but you will pass very little urine. Why? Because this stone is causing partial obstruction. So in men, this can be confused with prostate issues. So remedy, very simple remedy, 2 pan into 6 we have already done. Then 8 pan, 6 WD, 8 thymus chest also I have done it with you. So that will be very good. Then same treatment for the next one also, pain in the testicles, scrotum or labia in women. Okay, this is called referred pain. The pain can radiate from ureters into the lower groin or genital areas. This is very common when stone is in the lower ureter. So when stone is in the lower ureter, you will have this type of a pain. So this remedy is 2 pan into 6 treatments, 8 pan, 6 WD, 8 thymus chest. Then restlessness and anxiety during pain attacks. This again is, we have given this treatment, shown this treatment already. Last week, one treatment has been shown. Person keeps moving, cannot lie still due to severe pain. Severe pain. So this is the classic sign of renal colic. Renal means related to kidney colic. But this is very different from abdominal pain. In abdominal pain, the patient lies still. Whereas here, the patient keeps on tossing and turning, tossing and turning. He keeps moving because he cannot there is severe pain, he cannot lie still. So remedy again, first you have to make the stone softer, that is 2 pan into 6. Then you have to increase blood flow to the kidneys, 3 liver 0, 3 mucus 0, 4 thymus chest, and repeat every 15 minutes till the pain recedes. Now here I want to this thing, give you a real life incident so that it will stay in your memory. This is how effective this treatment is. You know, long ago, about I think 20 years ago, more than 20 years ago, I was in a place called Salem. You must be knowing, this is near in Tamil Nadu. Coimbatore, Salem, Erode, these are all places in Tamil Nadu. So I was there for some neurotherapy lecture, and one of the patients, this thing, was a doctor in a very famous hospital there in Salem, and his son had a problem for which I had gone there to help, as per the advice of my Guruji, who was alive at that time. So we went there. Then I helped his son, whatever was to be done. It was shown and all that. He had a therapist to do the treatment. And while that was there, this doctor got a call from his hospital staff. Said, sir, one patient has come in with severe pain. He's suspecting kidney stone. So he wants to get it operated. What do you suggest? So now he found out who the patient was. The patient was the son of a very influential businessman. So he told me, sir, do you think we can do something? Because once I have to operate and all, it will take some time. And though we can remove it by operation, do you have any other solution? Then I went and gave him this treatment. And believe it or not, that person, that boy, he was a young boy, around 22 years. Okay, so very young boy. He was, before the treatment, he was just twisting in pain and the excruciating pain, just crying out almost. And the nurses are all seeing that. So when I went there and I gave him the treatment is hardly 2-3 minutes. Okay, you know that 8 pan is about 8 into 6, 48 seconds. 7 this, then 6 WD is another 108 seconds. So 2 to 3 minutes, that's all. And the moment we gave this treatment, the person started becoming better. He said, sir, I am feeling much better now. So after about 15-20 minutes, I repeated the treatment. And then I told him, why don't you go to toilet and just see what is happening. So he said, this stone, I was told it's pretty big. Don't worry, you just go and see. I had given also 2 pan into 6. No. So I was very confident that the stone would have reduced in size. And then he went there. He said, sir, I'm feeling better a little bit. Still, I think the stone is there. I said, don't worry. One more 15 minutes later, one more treatment. And then he went to the toilet and he came out and he said, at last, I felt that something has gone out of my urine. I felt something like that. Obviously, it is such a small stone, you can't see it. But he felt it and he felt very relieved, and his pain had subsided nil. So he was very, even the doctor was very happy, and at the same time he was amused. He says, I never knew that you fellows are magicians. It is like you are having some magic wand in your hand. Why I'm saying we don't have a magic wand. It's all logical treatment, but treatment applied with proper logic. That is it. So that's how it was. So then with the last this thing, we are coming to a very important very important symptom that is called, let's see this very important symptom, swelling in the legs or around the eyes. This indicates chronic case, and it may suggest underlying kidney damage from recurring stones or blockage. So what we should do, we should check creatinine, we should check urea, and we should check EGFR, estimated glomerular filtration rate. So creatinine, urea, and EGFR must be checked immediately whenever you have swelling in the legs or around the eyes. Okay. What is the remedy? Very simple remedy: 2 pan into 6. Okay, because we know this thing, the recurring stones are there. The history will show that he had a prior history of stones. So 2 pan into 6, then 3 liver 0, 3 mucus 0, 4 thymus chest, then P heparin 6 ADR. But if creatinine is very high, suppose you find that, then you avoid this 3 liver 0, 3 mucus 0, 4 thymus chest. You avoid it. Just go 2 pan into 6, and then in its place you can give 1 point liver into 6, what I have shown you just now. So you avoid 2 pan into 6 and go to 1 point liver into 6. You avoid 3 liver 0, 3 mucus 0, 4 thymus chest, and in its place give 1 point liver into 6. So with that, this problem will be much relieved. Okay, and this creatinine will also start coming down. Then later on, if there is pain due to stone, you can give again thymus chest whenever needed. Then this is a common problem in certain states where people do not drink water, or they are unable to process the water. So the pain that worsens after drinking less water. Okay, they don't drink water at all. So this is common in some hot Indian climates. For example, Rajasthan, Gujarat, etc. in summer, Delhi also to a certain extent. So can happen. So this is linked with dehydration induced stone movement. Stone is moving here and there. Okay, because they are not drinking less water, they are not drinking proper water, so the stone is not able to come out. So the remedy is, of course, as usual, tender coconut water, and then 2 pan into 6, then 3 liver 0, 3 mucus 0, 4 thymus chest. Then finally, we come to no symptoms at all, especially if small stones remain in the kidney and they don't obstruct. They are called silent stones. So they are detected incidentally during ultrasound only. So they are dangerous if ignored. Why? Because they can go silently and cause damage. So that is the silent stone. So for that, again, 2 pan into 6, and then 3 liver 0, 3 mucus 0, 4 thymus chest. So with this, we have got a lot of material for those who have so many symptoms, and we still have some time. So I will go to the next step. Last class, I spoke about liver detox. And oxalate clearance. What is the treatment which we have just now done? 1 point liver into 6 treatment that boosts bile output and that reduces the oxalate. So oxalate stones, whenever you find oxalate stones, you should give 1 point liver into 6. And this, how does it work? It enhances bile production and liver detox, and it supports digestion and reduces internal toxicity. This we saw in the last class, but I did not show the treatment. Now here, 1 point liver into 6 treatment we all know. Then the last treatment is for pancreas. Okay, so we have got 2 types of treatments. One is 8 pan into 3 treatment. Then another is 10 medulla, 6 gassite, 3 gall. This is for a hormone called cholecystokinin. Cholecystokinin hormone. This is the hormone for the gallbladder, for stimulating the gallbladder. And then you have also an additional treatment for pancreas, that is for metabolic boost, that is called 10 pan into 3 treatments. So now 8 pan into 3 will do different job, 10 pan into 3 will do different job, and all these have been very well documented. So that is why, so we have got one treatment called 8 pan into 3, then we have got this treatment in between, then later we can give a 10 pan into 3. So whenever I say 8 pan into 3, it means 8 pan with 1 minute rest given thrice. 8 pan with 1 minute rest given thrice is called 8 pan into 3. Okay. So since you know pan treatments, we'll just still show you, but it's very simple. I'll show you only one 8-pan, then I will say repeat this 2 times. Okay. This is for people who are having, what is its purpose? Purpose is to stimulate pancreatic enzymes. And what does this do? They help uric acid metabolism. So for people who are having a bit high uric acid level, for them, this treatment will be useful. And it also 10-pan into 3 treatments, it increases insulin secretion in the body. So it supports insulin secretion and glucose metabolism. This is used in chronic diabetics or stubborn sugar imbalance. Okay. And what is the relevance in kidney stone? The high blood sugar is directly linked to uric acid stone. So you have got oxalate stones and you have got uric acid stones. So high blood sugar is related to uric acid stones. And then enhancing the pancreas by stimulating pancreas with 10-pan, it improves metabolism and thus lowers risk of metabolic syndrome. Diabetes is considered to be a metabolic syndrome disorder. So that is why this is given. And this helps to correct the underlying glucose metabolism, which is essential in uric acid prevention. So glucose metabolism is essential in uric acid stone prevention. So now this will again come to the treatment. What is the treatment we are going to do? We are going to do liver, we have already done. So we'll do 8-pan into 3, then 10 medulla, 6 gastric, 3 gall. And 10-pan, of course, I will show you one. So all these things I'll show once, then you can understand. Okay. So with that, we will be calling it a day. Now it's now 9:35. So within another 10 minutes, we will be calling it a day. Okay. So fine. Now we stop share. Okay. So the first treatment is 8-pan into 3. So I'll show into 1. Okay. Then you can repeat it whenever needed. 8-pan again, as usual, keep your hands like this, press it over here. So 8-pan means 8 times only we'll do. So we'll start, lean forward, 1 1 1 2 1 3 1 4 1 5 1 6 2 1 2 2 2 3 2 4 2 5 2 6 3 1 3 2 3 3 3 4 3 5 3 6 4 1 4 2 4 3 4 4 4 5 4 6 5 1 5 2 5 3 5 4 5 5 5 6 6 1 6 2 6 3 6 4 6 5 6 6 7 1 7 2 7 3 7 4 7 5 7 6 8 1 8 2 8 3 8 4 8 5 8 6. So this was 8-pan into 1. Now you will have to wait for 1 minute or 1.5 minutes. Again repeat 8-pan. Again wait for 1.5 minutes. Again repeat 8-pan. So by doing all that, whatever pancreatic enzymes are needed for the body, they will start getting stimulated. They are good, whatever needed for digestion. And how does it help? It helps in uric acid metabolism. So then you have got a treatment. This also reduces high blood pressure. This next treatment. So that is called 10 medulla, 6 gas, 3 gall. Very simple treatment, but very effective. What does it do? It stimulates a hormone called cholecystokinin. Cholecystokinin is a hormone which is made in the duodenum, and this is very useful for gallbladder, for duodenum and jejunum stimulation. Okay, so this is very useful. So we'll teach you that. So we did 8-pan into 3. Okay, I have showed you. Now 10 medulla, 6 gasi, 3 gall, and they have to be done at a stretch without any rest in between. 10 medulla, 6 gasi, 3 gall. So gasi is given in the calf muscles, and gall is given on the left side. Medulla is given over here. Okay, so we'll see this. Okay, so we start 10 medulla from the left side. Start again. 1 1 2 2 3 4 5 6 7 8 9 10. 10 medulla on the left side, then 10 medulla on the right side. 1, 2, 3, 4, 5, 6, 7, 8, 8, 9, 10. Sorry, 10 medulla on the right also. 10 medulla on the left, 10 medulla on the right. Okay. So then 6 gazi. 6 gazi is over here. 6 rounds of 3 locations. Okay. So now what you have to do, you have to pull inwards like this. So you have to pull inwards and then so start 1 1 1 2 1 3 1 4 1 5 1 6 middle location 1 1 1 2 1 4 1 5 1 6 end location 1 1 1 2 1 3 1 4 1 5 1 6. Second round 2 1 2 2 2 3 2 4 2 5 2 6 middle location 2 1 2 2 2 3 2 5 2 6 end 2 1 2 2 2 3 2 4 2 5 2 6. Third location, third round 3 1 3 3 3 4 3 5 3 6. Middle 3 1 3 2 3 3 3 4 3 5 3 6. End location 3 1 3 2 3 3 3 4 3 5 3 6. Fourth round 4 1 4 2 4 3 4 4 4 5 4 6. Middle location 4 1 4 3 4 4 4 5 4 6. End location 4 1 4 2 4 3 4 4 4 5 4 6. Fifth round 5 1 5 2 5 3 5 5 5 6. Middle location 5 1 5 2 5 3 5 4 5 5 5 6. End 5 1 5 2 5 3 5 4 5 5 5 6. Last round 6 1 6 2 6 3 6 5 6 6. Middle 6 1 6 2 6 3 6 4 6 5 6 6. End 6 1 6 2 6 3 6 4 6 5 6 6. Then 3 gall. 3 gall. I am covering it in three locations. So again, pull inwards like this. 1 1 1 2 1 3 4 1 5 1 6. Middle 1 1 1 2 1 4 1 5 1 6. Kneecap 1 1 1 2 1 3 4 1 5 1 6. Second round 2 1 2 2 2 3 2 4 2 5 2 6. Middle 2 1 2 2 2 3 2 5 2 6. End 2 1 2 2 2 3 2 4 2 5 2 6. Third round 3 1 3 3 3 4 3 5 3 6. 3 1 3 2 3 3 3 4 3 5 3 6. And 3 1 3 2 3 3 3 4 3 5 3 6. That's all. 10 medulla, 6 gazi, 3 gall. This is actually called CHOLE treatment. Okay, this is for cholecystokinin. Okay, so this is it. So with this, my demonstration, theory, everything is over, and we will come to other things next week. So we showed you so many symptoms, what are the relevant treatments, and then also we showed you the liver. You have already seen how it is useful in uric acid metabolism. Then we have seen pancreas metabolic boost and how. And then after this, we have got 10 pan into 3. So that I will just show you. 10 pan is already very simple. We have done 8 pan. Similarly, we do 10 pan. So 10 pan into 3, I will just show you, and then with that we'll call it a day, call it a night. Okay. Now 10 pan. All of you, anybody can do it. Wonderful, because it stimulates insulin. If you have had lunch, dinner around 7:50 or 8, you can do this. It will be good for your reducing diabetic tendency. Okay, let's start. Okay, 1 1 1 2 1 3 1 4 1 5 1 6 2 1 2 2 2 3 2 4 2 5 2 6 3 1 3 2 3 3 3 4 3 5 3 6 4 1 4 2 4 3 4 4 4 5 4 6 5 1 5 2 5 3 5 4 5 5 5 6 6 1 6 2 6 3 64, 65, 66, 71, 72, 73, 74, 75, 76, 81, 82, 83, 84, 85, 86, 91, 92, 93, 94, 95, 96, 10, 10, 2, 10, 3, 10, 4, 10, 5, 10, 6. So this was 10 pan. Now after 1 to 2 minutes gap, you can go on repeating it if you want. So this whole thing, 10 pan into 3, it produces insulin, correct amount of insulin in the body, what is required for the body for today. It will produce that much insulin, and with that, whatever blood sugar level, whatever is there, it will get reduced. So it's a wonderful treatment. So with this, I will now hand over to Anusha madam for summing up. I thank the people who have joined here, and if you have got benefited, you can please write in the group. And then, as madam has been telling, please join. If you are, anybody of you has diabetics or you have friends who are diabetic, please tell them to join Joshi's Kerala group, and they can join the diabetics class. A very nominal sum is 1,000 rupees is in place, so you can all afford, and then you can get benefited. Then slowly you can be out of your diabetic medication also. You know, people who after taking treatments for 6 months, 8 months, etc., they have been free from diabetic. Those who are not very serious, or at least they have been able to reduce their dosage substantially. So which means less side effects, and they are able to get better energy levels. They are able to get better sleep, better control over their other diabetic issues, etc. So all those things, benefits are there. So you can join and get benefited. Okay, it will be starting on July 11th by God's grace. July 11th is tentatively scheduled for diabetics challenge type number 2. And as madam said, so many protocols are there. So many people are giving so many treatments. Every treatment has its own plus points. And so anybody who joins this, he will get benefited. We have seen the benefits in the previous class. So that is why we are saying all of you can get benefited. We would like a world free from all medicines and free from diseases. That is my motto. To help people to build a world free from medicines and free from diseases, both. Okay, so that is all. That is the motto of Joshi's Kerala group, I can see. So let us work together. Okay, let us help Joshi sir in his noble cause. And Anusha madam is supporting us with so much messages and so many coordinations and everything. So, okay, with this, we now call it a day. I don't think there is any. Oh, there are some questions. Premlata ji has a question.
Doubt. Please note, this is the last doubt for this day.
Yeah.
So please don't ask any more doubts. 1 second.
Premlata ji, please go ahead.
Sir, I could not understand MU and WD.
Mucus.
MU and WD.
No. Wait. Let us see. MU and WD. No, MU is different.
Is you gave in swelling in leg.
Yeah.
WD you gave in frequent urination.
Yeah. WD is this point. You know, this point. Like this. We did know 6WD.
What to do in this one?
I'm pressing here like this. I'm pressing and pressing.
6 times.
No. I told you also that this is a treatment where you may require the help of another person. So what did you do? You lie like this and ask somebody to press. See here, first location here and here. Simultaneously, they have to press. Then second location, middle hand here and here. Okay, here and here. Middle hand here and here. Then third location here and here. And like this, you have to do 6 rounds.
This is WD.
Yeah, that is called 6WD.
WD on hand.
And where is mucus?
Mucus is in cuff.
Huh?
And MU, sir? MU,
where-
MU
where-
is given is swelling in leg.
Swelling in leg. Swelling in leg, I don't have MU. It is called MU0. Mucus
Yeah,
0.
MU 0.
MU0. I will show you. I'll show you this thing. I'll share. This is called mucus 0. See here.
Yeah, it's swelling in leg around eyes.
Yeah. See here it is liver 0, mucus 0. So liver 0, mucus 0 is now I'll show you that. I'll show you that. So that is liver 0. I told last time, I said one hand, see liver 0 is on the left side, liver 0. So I said you press like this and then simultaneously you press here. Press like this and press here. This is for liver 0, first point, then second point here, then here, same. Here the location in the shoulder does not change. So here and here, the 6 seconds pressure, then third point here and here, this is also 6 seconds pressure. So this is one round. Like that, I have written 3 liver 0 means 3 rounds. We have to do like that, 3 rounds. 1, 2, 3, and everywhere 6 second pressure. One pressure, 0.1 here, 0.2 here, 0.3 here. This is first round, then second round, then third round. Like that, this is left side is liver 0, and same way if you do on the right side, it is mucus 0.
Okay, now I understand.
Yeah.
Mucus 0 is the right side.
Yeah, mucus 0 on the right side, liver 0 on the left side, and this we did this last week, actually. Yeah. Okay, thank you very much.
Thank you, sir. Thank you, sir.
Yeah, my pleasure. God bless you, madam. God bless you. Okay. So now, Anusha, madam, you can take over.
So all of you, please note July 11th, most probably July 11th, we'll be starting diabetes paid class for which many have paid. So please don't miss your seats. Those who are here, you please go and pay. It's just an amount of 1,000 rupees for all our Joshi's Kerala group members. Otherwise, it's actually for our group only, sir has reduced, and for all your, participants, regular participants, has reduced it to 1,000 rupees. And I request all of you, please don't ask for earlier classes. See, earlier classes will not have any basement to this session. When this session starts, you will be directly speaking with sir. Diagnosis will be taken care. There will be a PDF or something which will be shared by sir in the group, which you will be filling, and according to that fill up. Everything will be discussed by sir with you. Actually, sir will take all your PDFs. He will go through. He'll make a mixed up, like many of you will be having mixed reactions or mixed, what to say. I'm not getting the word. I'm sorry. You'll be getting mixed problems or issues. So that will be discussed all together. All of yours will be put together and it will be discussed with you so that you can understand what it is and you can take the treatment accordingly. Okay. So all this will be done only in the paid group. And when the paid sessions are going on, there will be no free sessions in the main group. So I request all of you to please pay and join the main paid group so that you don't miss these sessions, and especially these treatments you can do for your friends, family, anybody. And as I told you today, if you make them sit with you, they will understand the treatment and make you help in making the treatment better for you all. Okay. So till tomorrow and day after tomorrow, we don't have session. We again have session on Monday, 8:30 p.m. Again, next Thursday and Friday. So please follow the group for all links, all sessions available so that you can join on time, please. Thank you so much. With all your gratitude, I am sending gratitude to Ramchandran sir. And please, I request you and Joshi's Kerala groups request you to please go back to the group and mention at Ramachandran sir and mention your feedback, question, whatever you have, you mention it. Okay. Until the recording link is shared with you, please don't ask for recordings. It will be shared with you on time within the week. And till then, please keep going through your notes and do your treatments. Okay. So till we meet on Monday, good night and sending your gratitude to Ramchandran sir for this wonderful sessions, for providing us all these wonderful sessions free of cost for Joshi Kerala Group. Thank you so much, sir. We are indebted to you and sending gratitude to you and your family. Thank you
Thank
so
you.
much. Gratitude, sir. You'll finish your blessing, sir? Yeah.
Thank you. Okay. First of all, I thank Joshi's Kerala Group, Joshi sir and Anusha madam and all the other team members for working together to build a holistic system, holistic society. Okay. And may God bless us all with his choicest blessings, with health, happiness, harmony, peace, prosperity, and success. May all of us and our families and the families of our friends and relatives be blessed with health, happiness, harmony, peace, prosperity, and success. Thank you. Thank you very much. I thank all of you for having joined this course, joined this session, and please also tell your other friends to join in the next classes. We'll be having more such with the practical sessions so people can benefit by it. Okay, thank you very much. Shubharatri, good night.
Good night, sir. Subratri, sir. Take care, sir. And see you next week. Till then, all of you, good night. Happy weekend to each one of you. And thank you so much for always filled with gratitude and gratefulness for your wonderful session, sir. Thank you so much. Good night, everyone. See you again on Monday. Bye-bye.
Bye-bye.